Hi guys, Dr. Mandi McCoy here at Drummond Chiropractic. As a lot of you know, I am the pregnancy specialist here at the office. But what a lot of you don't know is that I am currently pregnant. I am only 5 weeks along now, so you won't be seeing this video for quite a few weeks still. But what we're going to start doing is each week we're going to be releasing a video, and I'm going to kind of talk about what I'm going through and then what other bodies are going through, how baby's developing, some symptoms and signs you might be doing, and what you can do to kind of prevent those or fix them as well. So we're going to start with weeks 1 through 4. We grouped those together because not really much is going on in this time. Believe it or not, after your first period, you're not pregnant for about 10 to 19 days when you actually release the egg. And then it even takes a couple days after that for the egg to be fertilized. So you don't really notice any signs or symptoms in those first couple weeks. At week 4 is where we're going to start. So this is typically when you miss your period and you actually find out that you're pregnant. Sometimes you wait until you miss your period and that's when you realize you're pregnant. For myself, I actually had a bad reaction to pork chops, which I normally love, but they made me very sick afterwards. And I knew my period was coming up and we'd been trying to get pregnant, so I was like, let's just take a pregnancy test, and it was positive. So that was kind of my sign that I was pregnant. But some other signs that you might have, you might notice some spotting. So some people can mistake that for your period, but it's usually a little bit lighter. Some different mood swings. Again, this is around your period, so it could be just normal PMS symptoms. Breast tenderness, fatigue, or increased urination. For myself, the ones that I've been feeling a lot are fatigue. I think part of that is because my job is physical too, so while my body's going through these big changes and I work hard all day long, my body just kind of needs to get used to that. And another one that I've been having is increased urination, which could partially be because I've been increasing my water intake as well, just to keep my body a little bit healthier as baby grows. Some tips if you are currently trying is decrease caffeine intake. For me, I was drinking coffee every single morning and I actually switched to tea instead, which is better. And then also giving up alcohol, giving up smoking. You're gonna have to do that eventually when you're pregnant, so why not start early? Because sometimes you don't know you're pregnant until a little bit farther along and you wanna keep baby healthy anyways. Another thing is you can increase water just because overall that's gonna make you healthy, get better sleep, decrease your stress levels. And one of the most important things is taking a prenatal vitamin even before you're pregnant, because you want that folic acid that's in there, because that's going to help with brain development of your baby, and that's in a very, very early stage of your pregnancy. You want to consult either your OB or one of the doctors in our office here, because different patients need different prenatal vitamins, and you want to make sure you're getting the best for your body. A fun fact, at week 4, your baby's actually smaller than a poppy seed, so they're very, very tiny at this stage. It's still the biggest cell in your entire body, and this thing's gonna grow massively over the next couple of months. So next we're gonna talk about week 5. So week 5, you might notice that your symptoms are a little bit more intense. Like I said, for myself, I've been feeling a lot more tired, and I have been feeling more tired lately. I've been getting good sleep, but I have been waking up a lot more to use the restroom in the middle of the night. But when I do sleep, I am getting a deep sleep, so that is helping me, and my urination has increased as well. But like I said, I also have been drinking a lot more water to be overall better healthy for my baby, so that could be part of the reason as well. Week 5, there are a lot of big things happening to your baby. One of the first things is their heart is actually beating now. It's fully formed, and it's pumping that blood throughout the baby's body as it's forming. Another big important thing that's happening at this time is the brain and the spinal cord of your baby are starting to form. Now this is really important why you take prenatals and folic acid, because they provide the nutrients to get that brain and spinal cord to grow healthily for you. Different prenatals are going to have different recommendations, so it's always important to read the bottle. Sometimes it says just take 2 a day, and it doesn't specify, do I take 1 in the morning, 1 in the evening, should I split them up? If it just says take 2 a day, I recommend splitting them up. You can do 1 in the morning, 1 in the evening, but you want to break up so you can get those nutrients kind of throughout the day instead of taking them all together. And at week 5, your baby's now the size of an apple seed. And it's kind of amazing because they have a heart, their brain and spinal cord are starting to form, and that's all in the size of an apple seed. So you know how tiny that is when you eat an apple. All those things are starting to form on your baby. And then in week 6, your baby is actually the size of a sweet pea, which is a little bit bigger, but still not very big. It's only about 1/4 of an inch big. So if you want kind of a comparison, this is about 1/4 of an inch. So if I put my pinky up to it, you can see it's about the size of my pinky nail. So it's not very big, but this is how it looks. So you can see the head and the tail are starting to form, the heart's gonna be in there, and the brain and spinal cord are starting to form. So there is a lot happening in that small little area. And like I said, we will be releasing these every single week. I will go over what your baby's going through, what you might be going through, different things that you can do to help those first couple weeks, and then throughout your pregnancy as well. And I'll give you updates on how I'm doing, how I'm feeling, what I'm doing overall, just to kind of better myself as well.